An oral mechanism exam, which is going to examine your facial features and the inside of your mouth. I'm going to be touching your face and looking inside your mouth. Is that okay? Do I have permission to do that? Do I have permission to use this video?
Yes.
And record you? Okay.
Yes.
So first I'm going to be looking at your facial symmetry. Can you just face towards me and sit up tall and look at me? Okay. Everything looks symmetrical. Great. Okay. Can you open and close your mouth like this? And do it again? Okay. Great. Your range of motion is great. Symmetry is good. And movement is good. I'm going to be looking at your teeth. Can you smile for me? And open. Great. You have all of your teeth. They're arranged perfectly. Okay. Now I'm going to ask you to pucker your lips, like make a kissy face. And I'm going to press this against you. It's a tongue depressor. Great. Strength, symmetry, and range of motion. Okay, now I'm going to ask you to smile. Great. Now I'm going to ask you to puff out your cheeks and hold in some air. So go like this, like a puffer fish. Great. Now I'm going to look inside I'm going to look at your tongue. Can you stick out your tongue for me? Great. Okay. Now can you stick out your tongue like this for me? Okay, I'm going to press against it. Great. Now can you retract it? Good. Now can you move it to the right? Stick out your tongue and move it to the right. Great. Press against it. And to the left. Press against it. Okay. Now I'm going to ask you to move your tongue tip up, like this, and down. Good. Now I'm going to ask you to move side to side rapidly, like this. Good job. Everything looks good. Good range of motion. Now I'm going to look inside your mouth. I'm going to look at your pharynx first. Good. Normal color. Now I'm going to look at your hard palate and soft palate, which is the top of your mouth. Good. Great. Okay, so now normally in the exam I would test your gag reflex, but you have a heart condition, correct?
Yes.
So I'm not going to test your gag reflex today. Now I'm just going to look inside your mouth again, and I'm going to ask you to say, ah.
Ah.
Okay, and can you say, ah, ah, ah?
Ah, ah, ah.
Great. Everything looks good. Symmetry, everything. Your uvula moved normally. Okay. Now I'm going to ask you to repeat a few sounds. First sound I'm going to ask you to repeat is P, and I'm going to ask you to do that for 20 times.
Okay.
Ready?
Mm-hmm. Pa, 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 pa.
Great. Okay, now we're going to do the same thing, and we're going to do it with the sound T for 20 repetitions.
Okay.
Whenever you're ready.
Ta, 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 ta.
Great. Now we're going to do the same thing, but with the sound K for 20 repetitions. Whenever you're ready.
Ka, 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 ka.
Great. Okay, now we're going to add all those up, and we're going to say pa, ta, ka. The one word, pa, ta, ka, 10 times. Okay?
10 times. Okay. Pataka, 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 pataka.
Great. The oral examination is now finished. Thank you so much for letting me do this on you.
Thank you.
Do I have consent to test Gia and do an oral mechanism exam? I'm just going to be looking inside her mouth and touching her face to make sure everything is functioning properly.
Absolutely, yes.
Thank you. And I'm going to video record her. Is that okay?
Yeah.
Okay, G. I'm going to be doing an oral neck exam on you, which is just, I'm going to touch your face and look in your mouth, okay? And I'm going to be using this thing. It's called a tongue depressor. And it's not scary. I'm not going to hurt you, okay? It's going to go in your mouth to hold your tongue down. Deal? Okay. First, I'm going to ask you to sit up straight and look at me. Great. Your face symmetry is great. Okay, now I'm going to ask you to open up your mouth and close it. Like a shark. Good job. Now I'm going to look at your teethies. Now I'm going to look at your teeth. Open. Pull your tongue back. Good job. Awesome. Your teeth look great. Now I'm going to ask you to pucker. Kissy face again. Hold it. Good job. Your strength is good. Okay, now I'm going to ask you to smile. Nice pearly whites. Now I'm going to ask you to be like a puffer fish and puff your cheeks out. Like this. Hold air in there. Good job. Now hold it. I'm going to press against it. Good job, G. Okay, now I'm going to look at your tongue, okay? Open. Stick out your tongue. Good job. Now I'm going to ask you to stick out your tongue like this. Now I'm going to press this against it, so you got to hold it strong. Good job. Now can you stick out your tongue, go like, and pull back in? Good job. Okay, now I'm going to ask you to go like this. Stick your tongue out to this side. Hold it. Other side. Please. Good job. Okay. Now, I'm going to ask you to go like this. Lift it up towards your nose. And down towards your chin. Good. Now I'm going to ask you to go side to side like this. Good job, G. Okay, now I'm just going to look inside your mouth, okay? And I'm going to use this stick. Sound good? Okay. Ready? Open. Go. Okay, your pharynx looks good. The top of your mouth looks good. Okay. Good job, G. Now I'm going to ask you to say, ah. Ready? Say it again. Hold on one sec. Open real wide for me. Say, ah. Say, ah, ah, ah. Good job, G. Okay, now I'm going to ask you to say some funny sounds, okay? I'm going to ask you to say puh 20 times. Keep going. Good. Now we're going to say tuh. 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 We'll do it one more time. Tuh. Okay? Okay, ready? Now we're going to do ka.
Ka.
Okay, as fast as you can. Ka.
Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka. Ka.
Great. Okay, now we're going to add it all up and say pataka. Okay? Try for me. Okay, ready? Good job. Awesome. High five.